Hey ReFam, my name's Kate and welcome back to My Surgeon Says, a podcast with real surgeons, real experiences and real advice. Today I'm joined by our resident face guru Richard and we're talking all things facelifts. He reveals the most overhyped trends in facial rejuvenation, which area is the hardest to operate on and his tricks to achieving a natural looking result. As always, please rate and review wherever you're watching or listening. It really does help people find our little podcast. Welcome back to My Surgeon Says. There's just the two of us today. We'll kick off as we always do with a recommendation corner. RB, take us away.
Well, I've always been into running, but I've really got into it a little bit more in the last couple of years. So I've done 2 Melbourne marathons and about to do Gold Coast. But I recently did Run for the Kids, which is 14.4K over the Balti Bridge through the tunnel. Achievable, I think, for a lot of people, maybe not everyone, but I think for a lot of people. But I was just out on the weekend, I ran out to Dights Falls, and I was saying to Lisa, there are just so many people running. I've never seen anything like it. I really enjoy it. Time to yourself, no one can really bother you. My phone when I'm running goes to do not disturb so I don't get messages or calls, which is about the only time in my life when that happens. Listen to a podcast, listen to music. Running along the Yarra is really beautiful. And once you get out past around Collingwood's Children's Farm, it is just spectacular along the river.
Yeah, I know. I feel like when I would run along the Yarra, I was like, there's actually nothing better. And then I just never ran again. Maybe it's time to get back into it. It's tough when you don't have like a goal to work towards.
I think it's a good point. It's good to have an event. We're lucky. There's so many great events.
This weekend I went to Sydney and I went to Sails on Lavender Bay. It was so fantastic. Shout out to our waiter, Alex. But it was just like, it's so beautiful. It's on the water. The food was so good. It's decorated beautifully. The staff were really great. So if you're from Sydney or you're going to Sydney, hot tip.
Great place to visit, Sydney.
Hot take. This week, we are talking more in depth about facelifts. We have already done a couple of episodes on this, which I will definitely link to in our podcast if you want more of the basic stuff. This is more of a level up for people that have done a little bit of research around facelifts and want to know some more niche answers.
Not a beginner's class.
Not a beginner's class. So last year, a deep plane facelift got a lot of publicity. We did unpack that, and like I said, I'll link to that in our show notes. But for anybody who's new here or wants a refresher, could you just give us a quick synopsis of what exactly a deep plane facelift is and what you think of the procedure?
Okay, so there are a number of layers of tissues in the face. So you've got the skin, subcutaneous fat, so the fat just under the skin. Then you've got a layer called the SMAS layer, which is like a supporting layer. Then you've got the nerve, which goes to the muscles of facial expression, and then you've got the muscles. If you want to add another layer, then there's the bone. So the deep plane facelift aims to tighten that SMAS layer, that supporting layer. And so it's a legitimate technique. It's just not my preferred technique.
And why isn't it? Why do you tend to veer away from that one?
You've got some limitations when you're just tightening that layer. So you can only really tighten it in one vector. And the face tends to age in different vectors, so directions, depending on which part of the face. So the mid-face descends differently to the lateral face compared to the lower face compared to the neck. And when you just got one layer that you can tighten, then you're very limited in how you can reverse the signs of aging.
Yeah, I think that's really interesting. I never thought about the fact that you need nuance across the face. Like it's just whatever, bringing a shovel to a pick fight kind of thing. Like it's just all at once instead of those different things. Yeah. Right. Okay.
And then the other aspect of it is you're operating right on the nerves. So advocates of the technique will say it's really good. You can see the nerves and avoid them. I prefer to not be anywhere in the ballpark of any of the nerves, because they're the nerves that are controlling the muscles of facial expression. So if you've ever known someone who has had a Bell's palsy, for example, where they've got a facial paralysis, it would not be impacting all of the facial nerve, but you might have a droopy lip, for example, And that can persist for weeks and months.
Yeah, right.
And I've just got extremely low tolerance to deal with that even for a relatively short period. Advocates say, well, it's only 3 months and it's fine. They cope fine. But I don't think I'd have any patients who cope fine.
I don't think I would at all. So what about like when you're doing your technique or your preferred mode of doing it, there isn't any risk of facial paralysis?
Well, I'm operating above that layer.
Right.
So I'm not I'm not operating on the nerve. So I'm operating mainly between that subcutaneous layer, between the skin and the SMAS. I tighten the SMAS just to give in the same way as we tighten the muscles from a abdominoplasty. So just giving it a nice foundation that you're redraping the skin over, but I'm not actually operating in the same plane as the nerves. So they've got a whole layer that's protecting them above where I'm operating.
You're not mucking around where you're not supposed to be.
I'm trying not to.
There's a lot of chat about a type of facelift. How does that actually matter in comparison to what a surgeon's technique or ability actually is?
Look, I think you've just got to look at surgeons' results. There are many ways to skin a cat, and there are obviously experts in deep plane facelifts. So some of the reported benefits are less swelling, less bruising, quicker recovery, less issues with skin healing. I'm not sure any of those things are necessarily true. And so I think you've got to look more at the result rather than what different technique people are using. Because a good facelift surgeon, they will have modified their technique to be able to get good results, and you should be able to see their results when you see them in the clinic or on social media, websites, things like that.
It's more than just like a marketing phrase, I think.
Yeah, look, there's components in a facelift which are all very similar. The incisions generally are quite similar, although there are variations there as well. There are a couple of specific variations which I really detest in a facelift, and I think they're really stigmata of someone having had a facelift. But essentially you're making a similar incision, either tightening the skin or pulling the skin with that deeper layer and then trimming off excess skin.
What are the 3, sometimes subtle, sometimes not, telltale signs of having had a facelift?
Okay, so I'm not going to go in like best to worst. I'll go from top to bottom. That's easier.
Oh,
so
of the face. I was like,
yeah,
that
the face
sounds like best to worst. Okay.
I can see where to be confused. So some people with this temporal incision, they put the incision in the hairline to try and make the scar less visible. The problem is if you've got the incision running up here, then the skin you're cutting out is the hair-bearing skin. And so you change the hairline, okay? You can have a step even in the hairline. So that's a really obvious thing. My biggest pet hate is the incision that goes behind or on the tragus. So tragus is this little bit of cartilage in front of the ear. I put the incision in front of it. The skin on the tragus is very specialized skin. So it's very different. If you're playing at home and you look in the mirror, you'll see the skin in front of this tragus is very thin. It usually has less sun damage, and there's a little divot in front of it. So if you put the incision like right on the edge of that or even behind it, then you're redraping cheek skin onto the tragus. And it's virtually impossible to recreate that contour, and the skin always looks different. So I put the incision in front there, and then going down the face is creating a nice earlobe. So if you don't leave enough earlobe or you suture the earlobe into the incision, then you have a Dr. Spock sort of ear, which for those who know what they're looking for would be another obvious sign that someone's had a facelift.
You're right.
A game I love playing at restaurants.
What actually makes a facelift look operated on versus undetectable?
A few things. So I think firstly, if the skin has been pulled way too tight, then it just like that windblown look, it just looks really obvious, particularly around the outer eyelid, that cat eye look. You want that to be redraped and have all of that skin spread around rather than just pulled really tight in one direction. So that'd be number one. Number two is you'll see, and I think this is peculiar to the deep plane, is that sort of horizontal animation line going out from the mouth. And there's some well-known celebrity who have that. So when you see that line coming out from the corner of the mouth, that generally is an indicator of a deep plane facelift. And then in some of those other techniques where you're pulling on or interfering with the line of pull of the muscle, you get funny expressions when people are smiling or animating. So you want it to stay natural when people are smiling, when people are not using their muscles. You want it to always look as natural as possible.
What are the hardest areas on the face to rejuvenate surgically?
Look, I think number 1, 2, and 3 is neck. Mm-hmm. If you think about when you're making your bed, okay, and so you've got your fitted sheet and the far diagonal corner to you, it has creases in it. And you're trying to pull that sheet from the opposite diagonal. That's the hardest place to get the wrinkles out from. And the neck is that in a facelift. It's the furthest away from all of the incisions.
Yeah, okay.
There's also a few other issues. There's often a lot of loose skin there. So if you pull that super tight to really get a really good result there, you're going to overpull other areas. So there needs to be a little bit of balance. And sometimes you need to even resort to actually removing skin from that area because you just can't get enough skin out.
And by that, do you mean like bringing the scar down into the neck area so that you can cut it out?
Bring it into the front.
Oh, okay.
Yeah. So there are a couple of things you can do. Obviously, we're retightening the skin. Then the other thing is to try and create a cavity for the skin to shrink back into. So you can defat some of the subcutaneous fat, and you can also remove a little bit of fat from between the platysma bands, which are those muscles in the neck. Mm-hmm. And you can even either shrink the submandibular glands, which are on the side here, just near the angle of the jaw, or remove part of the submandibular gland. They're all techniques that empty out the neck so that the skin is going to redrape and then tightening the skin, but you're still the furthest away from where the incision is. So if there's going to be any relapse, it's often in the neck.
And what does that gland do when it's at home, the one you want to remove?
It's one of the salivary glands,
right,
but not one of the major ones. And you can certainly live without it or live without half of it.
Yeah, right.
Fun fact, one of the tools we can use to shrink the submandibular gland is anti-wrinkle injections, which we can inject intraoperatively, which is a good way to start. But then you can also keep on doing it subsequently if they recur. Ah. So not only good for stopping muscles contracting, but commonly used for excess sweating, and also can use it for salivary.
Okay, yeah, because I knew about using anti-wrinkle for hyperhidrosis type things, but got you. So if somebody's really drooly, they can also do it.
Yeah.
No, that is a fun fact. You spoke about finding that balance earlier. I think it can be really difficult to know how much, like how aggressive to go on the lifting versus the volume rejuvenation.
Yeah.
How do you assess that, and does it often change between that initial consultation assessment period and then when you're actually in it?
One thing I'll always do with a facelift patient, if they've got fillers in, is dissolve it at least 2 weeks before surgery, so you know exactly what you're dealing with. Yeah. I do it earlier, but patients then struggle to deal with not having the volume. And then there are a couple of techniques we have to revolumize the face. One is repositioning the fat. So in particular, the malar fat pad, which is this sort of triangle of fat in the mid-face. So repositioning that vertically. And then also fat grafting. So using fat graft in the similar area, also in the perioral area, into the lips. So it's also a very useful adjuvant tool.
Would you do that first and then tighten the skin, or would you tighten the skin and then fat graft?
So fat graft I generally do at the start, because that's in a more superficial layer. In the way I'm doing it, the fat is being redistributed with the skin. So that fat is sitting within the skin. I dissect that with my skin flap, right, and then reposition it.
Does it ever change between when you're doing that consult, like in terms of what you think you're going to do, and then when you're like underneath the layer surface, or not really?
No, not really. I mean, you know pretty much what you've got, and there's not other fat that you can redistribute, and fat grafting you can use anywhere. So if there were other areas you needed to volumize, then you just use additional fat grafting.
Speaking of balance, something that's very common across all the surgery you perform is the balance of being aggressive enough that you got a really impactful result versus being too aggressive and it's dangerous or the patient just looks crazy. Is that something, obviously in a face, you're working with way smaller margins of error. You've got way smaller skin compared to something like a breast reduction or a lower body lift. Do you find that balance harder to hit in a face, or which areas are maybe the most difficult?
Well, I think particularly eyelids. The skin, not so much. There's obviously a skill in knowing how hard you can pull the skin, but it generally looks quite natural on the table as you're tightening the skin. But eyelids is one particular area. So in the upper eyelids, if you take out too much skin, you have problems closing your eyes. Not great.
No, not great.
And in the lower eyelid, depending on which technique you use, so I like to not interfere at all with the skin. I do what's called a transconjunctival approach. So you're going on the inside of the eyelid, leaving the skin. So that's leaving a lot of the support structures, the muscle and the skin intact. But that's also an area that is very hard to correct if you are too aggressive in the lower eyelid. So lower eyelid is probably the area of facial rejuvenation surgery that has the most potential downside. And it would be an area where I'm tightening that fat layer, trying to shorten the lid and revolumize with some fat grafting. But if there is still some persistent skin after, that's a procedure I often do in the office under local anaesthetic, which is very well tolerated.
Better to be able to close your eyes then.
Well, with the lower eyelid, it's more that it's pulling down on the eyelid. So you get what's called scleral show, so you can see the white under the iris, or ectropion, where it's pulling away from the glow, neither of which are great.
God, eyes are scary. Are there cases where a less aggressive approach gives more natural results, or like is that kind of an oxymoron in a way where like maybe being really aggressive there actually makes it look more underdone?
I think I'd frame it more in terms of extensive, in terms of how much operating you're doing. So I think sometimes if a patient's seeing me and they're mainly only talking about lower face and neck maybe, and I say, listen, really, we should also address your brow, your eyelids. It sounds like I'm being more extensive, but it's actually just more harmonious. And so I think you get a more complete result rather than having these disproportionate areas in the face. So it's not more aggressive because it's the same technique, but you're operating on more parts, which sounds like it's more aggressive, but actually you're doing that to give a more balanced final result.
We've talked a lot about facial rejuvenation as a holistic thing, and again, we'll link in the show notes. But do you have a limit to how many areas you'll operate on once in the facial area?
So I think face is a bit different to other parts of the body, and there's a limit to the number of areas. So if you felt all of the face warranted addressing, then you would always just do all of it. It's one part of the body, essentially. So whatever needs to be done, you do in one sitting. Facelift can vary really from 4 hours to 8 hours, but it's not really an operation that I would split up and say, let's start with lower face and then come back in 6 months and do upper face, like say we would if we're sometimes splitting a breast lift and a breast implant.
How does skin quality or bone structure impact a facelift's results?
Look, they're critical. One of my good friends and mentors, Peter Callan, he talks about the high-risk facelift, a young patient having a facelift, because by and large, the aging changes aren't as dramatic, and if you don't get it right, the consequences are much more significant. But the results can be unbelievable because the skin quality is just so amazing. And you can get away with so much, and that's not unique to the face. It's the same in a breast. So doing a breast reduction on a woman in her 20s compared to someone in their 60s, you can always make a much better shape because the skin has such better elasticity and better qualities. So having great skin makes a really big difference, and the underlying bone the same. If you've got high cheekbones, good jawline, all of those things are going to complement anything that you can do to the skin in terms of tightening.
High cheekbones. Something often talked about. So is that just like your skull underneath has more protruding cheekbones? What does it come down to?
So a combination of two things really, that it's firstly it sits higher and then it is more prominent, so it sits out further compared to, say, the lower face.
Facial revision surgery at RE isn't something super common, but there are a couple of scenarios I want to talk about.
Yep.
Patients that come back for a revision or maybe even an additional surgery because they maybe opted to have less operations at the beginning or maybe just the wrong one for what they need. Can you talk about that a little bit?
Yeah, although I said my preference is to do it all at the one time, that doesn't suit all patients all the time. So I've got a patient currently who wanted to have a brow lift and blepharoplasty, which we've done, and she wants to come back later and have her face and neck done. There's no reason you can't do that, and she chose to do it the other way for a variety of reasons. So
surely that's easier, isn't it? I imagine doing your neck and your lower face and then coming back later to do bleph and upper would not be as harmonious. But is that wrong?
I don't think it would make too much of a difference. Okay. It's probably 50-50 that I do face and neck as a standalone and eyes and brows as a standalone, probably
because they're just
50-50.
Like different spheres as opposed to like you wouldn't do like a brow and a neck.
Correct.
Yeah, okay.
Yeah. So they're adjoining areas, so they go together well.
The other scenario where maybe not so much a revision as like a tweak, we alluded to it earlier, but patients who are coming back who maybe just want like a little bit more skin taken off, maybe how do you approach those? How common are they?
Depends which part of the body it would be. So you might be able to do like some sort of direct excision in the neck, maybe under local anaesthetic. Sometimes the healing behind the ear isn't quite as good as the rest of the incision. Sometimes you can revise those also in the rooms. We talked about eyelid surgery before that can sometimes be done also in the rooms. If it's anything more extensive than that, or it's multiple areas, then it's probably just easier and more efficient to go to theatre and do it there.
How does previous surgery change or limit what you can do in future surgeries?
Well, it can make surgery much harder because there's a lot more scarring. So in the last decade or so, there's been a lot of permanent or semi-permanent products that people have had injected into their face. And so when you're doing a face and neck lift, you'll see all of those products often still there, or the remnants of them still there, scar tissue, things like that. So that makes it way harder to dissect because it's not a natural plane. And the same goes a little bit with previous surgery. So there would be scar tissue still there. Often it's been some time, so that has often settled down. But the remnants of some of those injectables, not the hyaluronic acid ones because they do dissolve and go away, but there are some other products which do hang around. Sutures, so people had thread lifts, they might still be hanging around. So yeah, they would definitely all make things harder. Not insurmountable, but you've just got to take more care and make sure you're staying in the exact same plane and that your skin flaps are staying the same thickness because you don't have your usual landmarks. So you've got to go more by feel a little bit.
That's so interesting because I bet all of those products are marketed as like completely dissolvable, like all out of the system. Like
the hyaluronic acid ones are, some of the other ones are not.
Like they're not like, oh, anyway, in 20 years there will still be remnants of this toxic thing in your body.
Also, I think some of the people having those products are maybe in their 20s or 30s and maybe not projecting to being in their 40s and 50s and thinking, what are the consequences of this if I have a facelift down the track? And certainly the practitioners doing it are not saying, now, just in case you do have a facelift down the track, beware, this will make it harder.
But I think even more than that, what I'm saying, they're being told that they're not going to have them forever. So even outside of a facelift, it's like, would people still be having that if they were like, oh, there will be remnants of this in my body in 30 years?
Yeah, no.
What do you think the most overhyped facial trend is in terms of surgery? And how do you think it compares to the reality?
I think probably just back to what we started with, the deep plane. I think in the right hands it's a good technique, but I don't think it's a good technique for the reasons that a lot of people think it is. Obviously, a few well-known celebrities have had that technique, so it's had a lot of airplay. And it sounds more technically demanding, and sometimes people equate that with a better result. And the other thing people think is it's a more natural technique. I think there's a little bit of misunderstanding in terms of the expectations and the reality for that technique.
I think so because it's like, I don't know, deep plane sounds like you're really getting your money's worth.
Yeah,
like they're
I think that's
digging in
true.
and they're pulling
Yeah.
tight. So it's like there's more to it. But yeah, and I think the same as the internal bra where it's a technique, but it's being seen as its own operation.
Yes. Wow.
Wish someone was asking me these questions.
Can I steal that answer?
That's everything I've got. Is there anything you want to add for people who are like considering facelifts or just interested in the process?
Look, it's a very good operation. Obviously, you need to be a bit more prepared in terms of recovery because unless you want people, you're happy people knowing, you're really going to have to stay out of the public eye for 2 or 3 weeks while the bruising and swelling is largely settling down. But it can be a very rewarding procedure. And I think gone are the days where it was just in the domain of the rich and famous. I think it's a much more common procedure now than maybe it has been in years gone by.
On that, head to our TikTok because I feel like we're going to have some really good videos explaining different bits about the recovery specifically. Don't miss those. Thank you so much. If you liked that episode, there's plenty more where that came from. Maybe start with some of these or head to our channel for your peek into the mysterious world of plastic surgery.